We were providing that information in the early stages. In terms of number of cases, we actually reported with our first wave of cases involving nursing homes. We published that information and put that out. I want to underscore, even in the time where we were directed to not release that information has always been shared with the facilities. And we have worked with the facilities to make sure that the families of patients who have tested positive have been notified, and also encourage them to notify their broader community of other residents and staff and family members. We have worked very closely with the nursing homes and long-term care facilities, starting back before, as some of you remember, before we had cases present. We provided guidance for them. And as the process has evolved and time has evolved, we've continued to make sure that they have access to the most recent up-to-date guidelines.
Flattening the curve is a process of encouraging residents to stay safe, stay out of harm's way, to follow the guidance that Dr. Gayles and the CDC has put out for us continuously over time. I think that the action teams that Dr. Gayles has talked about represent an opportunity for us to go into the communities, to do the contact tracing and do the monitoring of folks who are positive, but also to help them stay isolated and stay self-quarantined, I should say, to keep other folks from being in harm's way. As the action teams roll out and continue to roll out, one of the things we're doing in concert with the state is identifying people who have needs that go beyond the immediate medical needs for other services. So rental assistance is an example of that, utility support, food support for folks, and cash assistance like the emergency assistance relief plan that you've heard about.
The testing component. So I've heard, I receive emails that say, well, we're not testing people. How do we get access to tests? So if they're based upon the CDC guidelines and the state guidelines, testing for individuals who are developing symptoms is happening. And that is going directly to the state public health lab. We are looking, as you know, the CDC released new guidelines that talked about asymptomatic patients. And what we would potentially do for that. We're having conversations to talk about how we could potentially adjust that criteria on a local level. And as it relates to the other component, so that's testing of the residents. So as it relates to the other component in terms of testing staff, we have worked with facilities to help get them access to testing, whether it's leveraging their relationship with private labs that they use for their other services to make sure the staff get tested either potentially there, or working to help them facilitate testing through their primary care providers or other mechanisms throughout the community, whether it's through an urgent care facility or some of our alternative testing sites.
We're going to continue to try to find things, and we're searching the world. We're not limited to what's in our backyard. We're looking for places beyond our backyard.